all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. Welcome to a brand new episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. As you are aware, this is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we are delighted to have with us Dr. Gurpreet Kaur from Al Hilal Hospital, Sitra. She is a senior general dentist with an experience of more than 29 years, and we would be discussing the subject, the myths and truths in dental care. So doctor, welcome to the show.
Thank you. Thank you for having me.
So doctor, our topic is myths and truths in dental care, and we have got a lot of queries from our viewers. One of the important queries is tooth loss genetic?
Yeah, actually there is people can have the genetic factor plays a very important role in the dental diseases or the oral diseases, but it's a combined thing, like it is influenced by the environmental plus the genetic factors both. You know, one person can have the problems of the gum disease or the tooth decay that can lead to the tooth loss, that can be affected by the genetic factor, but their lifestyle habits, like their diet, how they take care of their teeth or the oral health, or how they what are their habits like smoking or the other habits, or how is their overall health, that also influence a lot. Because of this genetic factor, the genetic, or I should say the genetic factor can decide how the tooth is supported by the gum or the bone. But the very good oral health care, like if they are taking care of their oral health very well, brushing twice a day, flossing, and regular going to the dentist, that can drastically decrease the tooth loss. So it can be many folds. It can be decreased by their environmental factors or their good oral health care. So yes, genetics plays a major role, but you can make it very less with your own care.
Okay. And the query from a pregnant lady is it safe to visit a dentist during pregnancy?
Yeah, it's a very common myth, that the pregnant lady should not visit the dentist because it is not safe to visit the dentist during the pregnancy. But they must visit the dentist during the pregnancy. Though they need to take care of few things because of this, hormonal changes, hormonal fluctuation. A lot of hormonal fluctuations occur during the pregnancy. The level of hormones goes very up. So that affects gums in many ways. Like they got a very good blood circulation, they get inflamed, red, and they bleed very easily. So they need to take care. The most safest period during the pregnancy to visit the dentist is the second trimester. Like during their 4 to 6 months, that is the safest period. Any of the kind of the problem they have, they should get treated during that period, and they must visit during the second trimester to get their teeth clean, professional cleaning. That is must. Usually the pregnant ladies who's coming to me also, they are saying like, we will do it after the delivery, doctor, we don't want to do it now because it will affect it can affect our baby. But it's the other way around. If you are not taking care of your teeth or the oral health during the pregnancy, it can affect your baby in many ways. In fact, like one way is like very few people are aware of about it, that if mother is having any cavities or any dental problems, so their baby are the 3 times more prone to have the dental diseases. And this can even lead to the premature birth, premature of the birth of the baby, or the baby can baby will be there. Baby will be born with the low birth weight. So it's very important to visit the dentist during the pregnancy time. And even the most of the ladies, they have the pregnancy gingivitis, we call that, is the gum inflammation, in that their gums bleed very easily. And some of the ladies, even they get a tumor kind of thing also in their anterior teeth especially. But it's a benign one. It's nothing to worry about that. Usually if you take care of your teeth and the gums very well, so after the delivery it subsides, it's on. So it's very important to visit the dentist during the pregnancy time. In fact, I will suggest, like, as normally they go for their regular checkups to the gynecologist, so at least once they can visit during the pregnancy to the dentist for the sake of their own baby, and of course for themselves also.
Okay, is it because of the morning sickness and all, they are not able to take care of their teeth properly? Is it a reason for?
No, that is another thing. During the morning sickness time, what happens? All the acidic part comes in their mouth, and what happened during this time? They usually all the acid that is coming in touch with the enamel of the tooth surface, and that erode very easily. And mostly the ladies do the mistake is, well, they have this regurgitation or the acid in their mouth, they brush immediately. They will go to bathroom, and because they not feel the taste will not good, so they brush immediately, and that is more harmful, because when the acid is already in the touch with the teeth, and if you are rubbing with the brush, that is making it more damage to the teeth. And the teeth become more sensitive. You might have heard that mostly the pregnant ladies, they have the more sensitivity of the teeth, and they have the more toothache, and they are become more prone to decay then, because once the enamel layer, first layer of the tooth is worn out, the second layer, dentine, is very soft, and it decayed very fast. So enamel is the hardest part of our body, even it is harder and stronger than the bones. But once that erodes, then it's spread like a fire, the dental caries. So it's they need to take care of this thing. And during the pregnancy, we usually recommend ladies to use the toothpaste which is not very flavored one, because usually the nausea, they got the nausea with the flavored thing. So simple toothpaste they can use, and just use the mouthwash. So all these things, like small things, they should take care of.
Okay.
And even to neutralize their acid, like half an hour before the brushing, they can use the baking soda, make this wash as a mouthwash. They can use it to neutralize it, so that they will not get that regurgitation.
Okay.
So
Doctor, one of my friends was complaining that she was brushing hard to clean the teeth more, and now the teeth is becoming more sensitive.
yeah.
So, what's your suggestion?
This is very common myth. Like if we will brush hard, our teeth will get more cleaner. But no, you are making the more damage to your teeth, like by brushing hard. You don't need to put more pressure on your teeth to clean them nicely. Only just 2 times a day harder, and many patients says that, like, okay, we brush 2 or 3 times, 3 times, so that our teeth get more cleaner. But it's not like that. You are using your toothbrush more times, so your teeth will get cleaner more. So it's again the other way around, like, because if you are brushing more, you are damaging your enamel more, like harder, because this is a mechanical abrasion, we usually call it in a medical term. So if you brush hard, again you are abrading your enamel and making the teeth more sensitive, plus more prone to have the dental decay. So excess of, it's a common saying, the excess of everything is bad. So don't overdo that one. So just brush twice a day. Here I will let you know the one rule. We call it a golden rule in dentistry. It's called 2-2-2, like 2-2. So 1-2 is like visit your dentist twice a year. Second is brush your teeth twice a day, and brush your teeth only for the 2 minutes, not more than 2 minutes. It doesn't require more than 2 minutes, like 30 seconds in each quadrant you can do. We have the 4 sides, so 30 seconds in each side is more than enough to clean your teeth properly.
Okay, now you mentioned about brushing the tooth 2 times. Some people say that we can brush the teeth once and then use mouthwash once. Is it possible? Like,
no. Usually the patient do this mistake, that like we are doing the mouthwash and that will take care of our teeth. But with the mouthwash, you cannot remove the food particles or the whatever the food is stuck in between the teeth. You cannot clean them with the mouthwash. So brushing plays a very important role. So nothing can replace the brushing. You must use the brush. Yes, mouthwash you can use as a supplement. For the supplementing, like it's a additional thing to the your brushing. You can use between the brushing. No need to use it after the brushing immediately. So you can use it during after the afternoon, after lunch, or in between, for the mouth freshness and for the cleaning, just like as addition, as an aid to the toothbrush. But it cannot replace the brushing, because it will not remove the food particles or the plaque which is stuck on your teeth. So it cannot be used as a replacement of the toothbrushing, because when you use a toothpaste along with the toothpaste has many components. Which has an abrasive, it has a flavored agent, it has a cleaning agent. So all these things are not there in mouthwash, and without the mechanical support, like without using the brush, you cannot clean your teeth.
yes. Now, doctor, coming to smoking, we know that smoke causes stains in the teeth, and some people believe that the only stain is caused by smoking for the teeth, and it is not injurious for the teeth. And some people go for vaping. So what is your suggestion about this?
Yeah, no, again, this is a very common myth, that vaping doesn't harm the teeth or the mouth, and the same way smoking only cause this staining of the teeth. No, it says only the one part the smoke cause the staining of the teeth. Along with that, it can cause your gum problem. It's a very, very common, like to have a gum problem in the smokers, chronic smokers especially, and over the period of the time it can cause the bone loss of the teeth. So that is very dangerous, and ultimately they can lose their teeth. And everybody knows, like cancer is also, oral cancer is one of the most common thing with the chronic smokers the patients have. And obviously halitosis, or we call it a bad breath. that is also there. So all these things are caused by the smoking. So, and a very important thing with the patient who smokes, if they have any other problem along with that, this smoking has a masking effect on that. Like they have the problem, but they don't have any symptoms for that. So they are not aware of it, like they have the problem because of this masking effect of smoking. So because usually the gum doesn't bleed very easily for the smokers, so they have, but they have very, very sensitive teeth. So they are not able to make out like what's wrong with their teeth. And as you said, the many of them now are replacing smoking with the vaping, but vaping is again very dangerous thing. They have chemicals in them and they can erode the enamels. They can cause the gum irritation, gum recession, and again they have the drying effect in the mouth. And the dry mouth again have the problem of they will again it make the teeth more prone to the dental decay, and they can lose their teeth. So that is also not very safe to use. Smoking or vaping, both are not good.
So doctor, as you are aware, most of the old age people, they tend to give less attention for dental care. Because they feel that the tooth can be extracted if any pain or something is there. So what do you have to say about this?
You see, if we have so many teeth, if God has given us so many teeth, so every tooth has their own function to do. It's not like that, like if we will extract one tooth and the problem will be solved. But it has many more consequences. If easily the tooth they will extract, but there are so many things. The alignment of teeth can be affected. The opponent tooth will grow more longer, and obviously the whatever things we are doing at the young age or during the childhood, all those things or those functions the teeth perform during the old age also. Like we are talking, we are laughing, we are eating, we are smiling, all things are there. So the teeth are equally important in every age, during the childhood, during the adult, and during the old age also. And going to dentist regularly will preserve their teeth. So it's not a solution to any of the problem that like, okay, we have this thing. In fact, if they will extract the teeth during the early age or in the old age even, if suppose like they have removed the 3 or 4 teeth and again they want to go for the dentures. So dentures they also need a support if there is a less bone support, because when the tooth is extracted, so the support of the bone level that goes low. So it's a very difficult to give the dentures in those patients. So it's very important to preserve the tooth as long as possible for the health of the bone also, because if the bone height is going less, so our face vertical height is also get less. So if the many patients in the adult age also, they want like, okay, I have pain now, I don't want any of the treatment, I want to remove it. But the face will look more old age. They will have the old age facial look more early than the later on. They should have what they should have at the later age. So the tooth should be preserved at every age.
Doctor, we know that dental flossing is very important. So can you explain about it more about us?
Dental flossing is, of course, it's a very important, at least once a day, and especially I will recommend it during the night time before going to bed. That is very important, because the dental flossing, usually we use it for the removing the food particles or whatever food stuck in between the teeth. So where the tight contacts, where the brush can't reach. So in those areas we recommend the flossing. So if you see, each and every surface cannot be cleaned by the toothbrush. So there are some areas which left behind during the brushing. So
like in between
the teeth. And if the food stuck remain in between the teeth, and why I said at the night time, because in the night time is very important, because when we sleep, the mouth activity is, there is no activity. We are not talking, we are not eating, and so there is a saliva flow is very less. So when mouth get dries, it's a bacterial growth environment, and the food is stick there. So definitely bacteria can grow more faster because they will have food, and then that can cause the acid formation, and that will lead to the tooth decay. So it's very important to floss your teeth during the night time. If you can't do it twice, it's once a day is also enough, but do it at night time. So, and nowadays though, it's very easy. Only in the tight context we recommend to use this thread floss. Otherwise, nowadays a water flosser comes. It's very easy to use, and even in during the kids who have like braces, or some of the patients who have prostheses, like they have bridge, they have fixed teeth, they cannot use the thread floss normally in those areas. For those areas, there's a water flosser. It's very easy and very convenient to use. So they can clean very easily.
Yeah. Now, doctor, can you explain about the connection between oral health and our overall health, general health?
Oh, it's very important, very, very important, because you see, our mouth is a gateway of our overall health. Like if our mouth is healthy, there is a chances that we can have our body healthy. In mouth, you see, nowadays it's by the CDC and with most of the research, it's already this has been proved that oral health is directly connected to our general health. Like if the patients are having any gum inflammation or the gum infections, all the bacteria can lead to your body and bloodstream, and they can even cause the heart problems, stroke, or the another cardiovascular disease, and they can make a plaque in the arteries, and that can cause the blockage in the arteries, and the patient can have the stroke or the other cardiovascular problem, or they can have the respiratory problems if it goes to the lung. And they can, during the pregnancy, I have already explained it, that like how it can affect the baby's health. They can lead to the premature birth of the baby, or the low birth babies. They can be lead to the low birth weight babies, and then they can even have the dementia. Now the research is going on, Alzheimer's disease, these things, respiratory problems. So it's completely there is a long list of these problems they can have during the if they have the problems in their gums or the teeth. So general health and oral health is completely connected in each and everywhere.
Doctor, my son was taken for a dental checkup last year. Then the doctor said that there is cavity in the front tooth. Is it possible to have cavity in the front teeth?
Yeah, of course, because you see, on the back teeth, the chances are more to have the cavities, because they have their structure is like this. They have the deep fissures and patent fissures there, so food stucks there. So there are the chances that they can have the cavities more in the back teeth. But in the front teeth also, if they don't keep them clean, and they have the frequent snacking, so they can have the cavities in the front tooth, especially in the, you see, children. For the childhood, during the childhood time, the children, mostly the babies, especially the babies who have the bottle feed more, you will see many of these small kids, they have all their front teeth black, and this is because they have this feeding bottle in their mouth during the night time. What mothers usually do, like if the baby is crying, okay, keep the bottle in their mouth, milk bottle, and they will keep quiet, and then they will sleep, so they can also have sleep. But this is very harmful for the babies, because all the milk keep collecting on around the front teeth, and that can cause the cavities in the babies. And the same way in the young children or the even adults, if you are not keeping these areas clean, you are not brushing properly or not cleaning them, you can have the cavities in the front teeth as well.
Now you mentioned about the babies. So the baby teeth will be replaced with permanent teeth. So why should we take more care about the baby teeth?
No, baby teeth, as I said earlier also, that the teeth are important in every stage of life. So the baby teeth are there, they fulfill many purposes, like as you know, all know, the smiling, talking, and eating, chewing food, all these things. But apart from this, these baby teeth, if they are not healthy, they can affect their successor. The permanent teeth can have the cavities if the baby teeth have the cavities, and if you are not filling them or you are not getting treated them, their permanent successor can have the cavities. And we need to keep the baby teeth on their place and not to remove them early, because if the teeth will be removed, so they are actually the guide path for the permanent teeth. If the baby teeth we will remove early, then their permanent successor can go another way, like where they have the easy path. Like we all have the tendency, we will take an easy path to go somewhere. The same way teeth will, wherever they get the space, they will go there. If there is a time differences for their eruption is the same or the nearby.
Doctor, another query from our viewers is that he doesn't have much sugar, still he has cavities. How is this possible?
Yeah, you see, sugar is not only the reason for the cavities. There is a long list of the things which can cause the cavities. Yes, sugar is an important factor, but along with the sugar, if you are having sodas, especially this youngsters, adolescents who have the sodas or the fizzy drinks or any sticky food, in fact, which remains stick on the teeth, so that can cause this cavities. Like especially, you know, in the sports athletes, they have many sports drinks. Yeah, they have the sports drinks or the energy drink, you say. They have a lot of sugar, plus some of them are the acidic also. So both the things add, like acid plus the sugar. So it is very harmful for the teeth. You can get the cavities in your teeth. Like, because acid part, what that will do, that will erode the erosion. They will cause the erosion, the level of the enamel will get less, and the sugar part, and they will stick on that, and the bacterial growth will be there, and cavities will be there. So it's not only the sugar which is responsible for the cavities. Any sticky food along with the acidic food, it can cause the cavities.
Doctor, now there is a practice of teeth whitening and many people go for it. Is it safe?
Yeah, it's safe. Like, if you have to be careful, you should not overdo it. As I said earlier, excess of everything is bad. Nowadays what is happening, like the people are getting the whitening done their own. They do whitening their own. Over the counters, there are so many products are there, so they are not using the trays which they are using, if they are not fitting well, so that can cause damage to your gums, damage to your teeth if we are not using the proper concentration. It should not be done without the consent of the doctor or the dentist. If they are giving you, because in the office when we give home bleach to the patients, we make the trays according to their size of the teeth. It's a custom made. It's not the like ready-made kind of the trays. So they should use it very carefully. So they should not overdo it. Some patients, what they do, if we are giving them or over the counter, they will take and they will use it regularly for the long time. That is not safe. Of course, because these medicines have the chemicals that cause the whitening of the teeth. It should be used by the dentist, and the dentist will guide you if it is needed at the home bleach, when and how you should use it. But don't overuse it. What now the common practice, anything they will do, okay, I want little more whiter, little more whiter. Suppose if your teeth are having very yellowish discoloration, but it should be treated over the period of the time. It's not like one time you can do it all. So dentist will decide that how long you have to do and how many sessions you will be needing it, and what should be the timeline. After how many days, after how many months, and for how long. Or usually we do the office bleach, we recommend to you, they don't need mostly for the 2-3 years. But the patients, what they do, they will go to the another practice and they will say, I want to do the whitening, yellow, because they're not taking care of proper things, like we are instructions, they are not following. So if you will overdo it and not use it properly, yes, then it's harmful, otherwise not.
And Dr.
It's completely safe.
And many of us has a problem of bleeding gums during brushing. So how can we overcome that?
Yeah, bleeding gums can be a sign of or the symptom of the many diseases, bleeding gums. So you need to be very, very careful. First one is if you are not cleaning your teeth properly, there is a lot of plaque and tartar deposits are there. So then you can have the bleeding gums. If you are taking of any kind of medication which have the side effect of gum inflammation, and again that can cause bleeding, like you have, if anybody is having blood thinner, for the heart trouble, so that can cause bleeding gums, or it can be caused by the leukemia. There is a long list like that can cause this bleeding gums. So you need to don't take it easy. I will tell this because it can be sign of one of the very big problem in your body, or the first symptom or the sign of the major problem, a major health problem. So you should visit your dentist regularly and don't take it lightly if it is a bleeding gums.
Doctor, another doubt is about the wisdom tooth. Most of us will have to remove it because of the pain.
No, it's not necessary. It's a very common myth that if there is a wisdom tooth, we need to remove it. No, if it is not giving you trouble, there is no need to remove it. Let the dentist decide that like if it needs a removal or not. Because most of the wisdom teeth, even if they are not erupting, they are not coming in the mouth, they will not give you any trouble. They will remain silent there for the years. And if it is infected, if it is giving you pain, then you have to go for the extraction of this tooth. Otherwise, no. Otherwise, there is no need for removal of the wisdom tooth.
Now about the root canal treatment. After we fill the tooth and then put the cap, is there any follow-ups to be done? Or will the teeth be safe after that?
Yeah, tooth is safe, but follow-up, it will be, it's like a normal teeth follow-up, like you have to go for that. It's not like that you have done it and you forget about it. You have to take care of the tooth as you are taking care of the other teeth. Like you can't miss it or you can't ignore it, but you have to take care of that. Not any special care you have to take, but yes, as a regular, it's not like that it will not have any other problem. Like it might have the other problem. It's okay, it's been treated, it's been crowned, but you have to take care of it as a normal tooth. You have to go to the dentist and they will check regularly, and most importantly the dentist will tell you after how many months you need to be follow up for this tooth. Usually first like 6 months, and 6 monthly anyhow you are supposed to visit the dentist. So it should be there. Regular follow-up should be there. It cannot be, you cannot ignore that.
Now, Doctor, now what is your takeaway message for our viewers?
Yeah, okay. So I would say like visit your dentist twice a year, as I said, because dentists not only take care or do the professional cleaning, or they will do the normal checkups. The dentist might be the first person to diagnose a major health issue in your body. Because we dentists, seeing in your mouth, we can diagnose a lot of things. You might be having diabetes. We can diagnose the first symptom with the seeing into your mouth. You might be, if your gums are inflamed and infected, it is going into your blood, so you might have some cardiovascular problem or the heart problem. Or after seeing your teeth, we can tell that you are undergoing any stress and anxiety over the long period of time. And after seeing your teeth, we can diagnose many more diseases like the oral cancer in the preliminary stages. We will able to diagnose that. And we can see that you are not doing brushing properly over the period. Though if you are coming to us and you are brushing your teeth and flossing very nicely, but still we can see that this is the first time you are doing it, brushing properly or flossing. So there is many things we can just look into your mouth. The dentist can diagnose. So please don't ignore your oral health, because it's a gateway of your general health. Healthy mouth has a healthy body actually. So don't ignore it, because after with the regular visits, you can save a lot of money. Because if usually they say like a dental treatment is very expensive, so we don't want to go to the dentist. Why should we do it when we don't have pain? But it's very important, because if you will go for the preventive care, if you will do the regular checkups, the problem can be solved in a very small period of time with the less pain or no pain and very small amount of money. If you will ignore the problem, then obviously it will become a big problem, then you have to pay more.
It will become more expensive.
Yeah, more expensive, more time consuming and more painful. So that's it. Visit your dentist. Always remember 222. If you are visiting your dentist twice a year, trust me, you can save a lot of your money, lot of your time, and maybe you can if you have any, God forbid, if you have any other problem, health issues, that can be diagnosed at very, very early stage. So that's my only the
And
message.
finally, doctor, what are the services you offer at Al Hilal Hospital, Sitra Town, especially in your department?
Yeah, in our department we are providing like cleaning, professional cleaning, and then fillings, cosmetic fillings, smile design, laminates, veneers, and we have a specialist also for the orthodontic treatment, gum surgeries, and root canal treatment we are giving. All the services we are providing to the patients.
Thank you, doctor. Thank you very much.
My pleasure, my pleasure.
So viewers, I hope all your doubts regarding dental care is cleared by your doctor. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.